Nausea, even the word is nauseating, and many of my patients come in saying that they're nauseated, which I'm not really sure how to take, really, but you know, the way they define it typically is they say, my stomach is something wrong with my stomach is upset. Well, in fact, nausea has very little to do with the stomach often, so we'd like to give you some reasons that it can cause nausea outside of the stomach, per se.
Well, actually, the first reason is the stomach.
Oh,
it's acute gastritis.
Some of those too.
Some of those too.
Yeah,
I mean, various offending agents, whether it be virus or even parasites, bacteria. We talk about the H. pylori bacteria. That's a real common one. So food poisoning, the flu, if it affects the stomach, of course, it's going to make you nauseated. But there are other diseases.
Yeah, migraine headaches. Central cause, for example, of nausea. Migraines can cause what's called gastroparesis, where the stomach shuts down. Causes nausea, take medications, it doesn't work because the stomach's not working.
Number 3 would be acid related. We talk about peptic ulcer disease, where excess acid eats away. You might even get this erosion or this ulcer. Even reflux disease, I won't say heartburn. Okay.
Other irritants like cigarette smoke and things like Advil, aspirins can cause nausea, so watch out for alcohol as well. Sorry.
Sorry, thanks. Yeah. For saying sorry. Number 5, noxious stimulants. So this would be smells or shock, or people get this hyperactive vagal nerve, which will drop the blood pressure. They feel faint and they might actually pass out, but of course they're going to feel nauseated during that sequence. So something that triggers that vagal nerve.
Other things are conditions, medical conditions like diabetes can actually cause nausea as a symptom. Problems with the pancreas and the gallbladder may present as nausea to start with.
And then there's the atypical diseases. Heart disease, if a person's having a heart attack, it may present as nausea, especially in females. They have the atypical heart symptoms. They might not get pain, they might get nausea, and that's a leading cause of death in women. And pneumonia or bronchitis, so lung diseases can cause nausea as well.
If you're nauseous, check your medications. Something in your medications can be causing that nausea. Certainly we all know that cancer-related medications, chemotherapy is very nauseating, but also other things. Some antibiotics can be nauseating. As we mentioned, Advil, that sort of thing. So watch your medications for nausea.
Now, a serious cause of nausea, number 9, bowel obstruction. So if you get nausea and vomiting, abdominal pain, distension, and a real big sign you're unable to pass gas, which is almost impossible for a fellow, then you know that this might be serious and to seek medical attention.
And another nausea causing, of course, is pregnancy, speaking of distension. Yeah. Anyway, yeah, morning sickness, which is actually not a true thing. Morning sickness in 80% of the people lasts all day long.
I always have a number 11. Maybe if you're watching us while you're eating, could be fairly nauseating.
Oh yeah, turn that television off now.